It's one of the most common health conditions across the globe. We're talking about 3.5 billion people worldwide.
Welcome to Radio Davos, the podcast from the World Economic Forum that looks at the biggest challenges and how we might solve them. This week, what is the health condition that affects us all, but is often seen as an add-on for healthcare? And how much is this neglect costing the economy?
When you look at the economic burden globally, it's about a $710 billion tax every year.
Open wide. We're going to the dentist to look at a new report that lays bare the economic and personal costs of failing to look after our teeth and mouths.
29% of low-income Americans say that their job prospects are limited due to the condition of their mouth and teeth.
And it's far from being just a first world problem.
The largest increases in the burden of disease are actually happening in low-income countries.
The report, The Economic Rationale for a Global Commitment to Invest in Oral Health, sets out the potential returns on investing more in oral health. And it's not just about our teeth.
When oral health improves, for example, among diabetes, pregnant people, people with cardiovascular disease, people with dementia, their healthcare costs go down. So if we invest in oral health, we see healthcare cost savings in other parts of the healthcare system.
Subscribe to Radio Davos wherever you get your podcasts or visit wef.ch/podcasts. I'm Robin Palmer at the World Economic Forum, and with this look into filling the gaps in oral health.
We all know mouth is connected to body, and we need to stop paying that economic penalty for neglecting oral diseases.
This is Radio Davos. Welcome to Radio Davos, and this week we're going to the dentists. A new report from the World Economic Forum found that half the world's population is affected by oral diseases. 3.5 billion people, with huge impacts, obviously, on their oral, their dental health, but also on other health conditions and on the economy. But oral health is often seen as quite separate from other health conditions and is often underfunded or excluded from health insurance schemes. To tell us more about that research and what should be done, I'm joined by Marko Vujicic, Chief Economist and Vice President, Health Policy Institute at the American Dental Association. Marko, did I get all that right?
You did. Thank you.
You co-wrote this report. This is the report called The Economic Rationale for a Global Commitment to Invest in Oral Health. Can you give us some of the headlines from that?
Sure. So as you mentioned, I'm not a health practitioner. I'm a health economist. But more importantly, about a year ago, the World Economic Forum formed an oral health affinity group. I'm one of the co-chairs, as you mentioned. Ali Neal from Henry Schein and Maria Ryan from Colgate-Palmolive were my other two co-chairs. And yes, we have worked diligently on trying to pull together all that we know about the economic impact of oral health. So a couple of headlines. It's one of the most common health conditions across the globe. So we're talking about 3.5 billion people worldwide affected by oral diseases.
What do you mean by oral diseases?
These are things like gum disease, caries, which causes cavities. Oral cancers are one of the fastest growing cancers now that we have better and better data. So conditions that affect the health of your mouth. Some of them are common, some are less common. But obviously very, very prevalent. For context, about 1 billion people suffer from mental disorders worldwide, 500 million cardiovascular disease. So it's a very, very common condition that a lot of people experience. Unfortunately, the disease burden is growing. But from the economic standpoint, I think probably the one headline that really stuck out when we looked at the data was when you look at the economic burden globally of oral diseases, it's about a $710 billion tax every year. Let's think about it on the global economy. Roughly half of that is productivity losses. So people can't work, they can't go to school because of oral health diseases. And that productivity loss stemming from oral diseases is more than, for example, asthma globally. It's more than cardiovascular disease. It's in the line of Alzheimer's. So it's in the top 10, let's say. Oral health is really driving economic losses. And that's something we haven't really talked about enough. We're paying an economic penalty for neglecting oral diseases.
Remind us that figure again, it's kind of the dollar figure of losses.
So overall, it's $710 billion in economic losses worldwide, and roughly half of that, $323 billion each year, in productivity losses.
It's a very new report, right? It's only been out for a couple of weeks. But the people who've seen it so far, did it make them step back, or are the people who are reading this, they knew this already?
Well, I'd say there's two camps, right? Let's say the oral health community or the advocates for oral health that obviously are committed to the cause and knew this, but did not have the scientific basis for a lot of these arguments. We really tried to be disciplined in this report to cite the scientific literature. So look, when you're talking to ministries of finance or ministries of labor and education and development, you got to stand on some evidence, right? So we really worked hard to pull that together. The second audience is kind of the broader community of oral health, civil society, the private sector. And yeah, the feedback so far has been like, well, we kind of knew oral health was out there and separate and people had challenges. But wow, when you put it all together in some of these charts and reports, we've definitely gotten feedback so far, certainly from the policymakers. There was a group of us recently at the World Health Assembly out in Geneva at WHO. And more conversations are happening about this. I mean, WHO has launched an action plan that is really compelling, saying, okay, here's what ministries of health, here's what countries can do, here's what the private sector can do. So there's momentum building, I would say. But we're just starting here. And it's amazing for a group like the World Economic Forum. This has been super exciting for somebody like me that's worked in health policy. It's a whole other set of stakeholders and a whole other set of arguments and value propositions we're able to bring forward. So we're excited to go forward with this.
One thing that comes very clear in the report, and it's just obvious to most of us, is that oral health or dental health is often seen quite separately from your other health. I mean, I live in Switzerland. In this particular healthcare system, which is very Swiss, probably different from anywhere else, you have health insurance, but usually it doesn't cover dental health at all. That's a completely separate thing. I'm from the UK, and there's an absolute crisis there where healthcare is free at the point of delivery, but it's very, very difficult actually to get onto an NHS dentist list. And I think there's similar but different situations in various countries and economies. But why is it seen as so separate?
First of all, it's really important to highlight that a stylized fact, you look at OECD, you look at developing nations, you look at different regions, consistently, dental care services or oral health care services are consistently the healthcare service that stands out in terms of barriers to care, particularly financial barriers. So if I compare dentistry to prescription drugs, to mental health care services, to specialized care, specialty care, boom, dental care and oral health care services are usually the service that people have the toughest time affording and getting to. So it echoes your personal experience. So there's very strong evidence on that. Why we came to this position, there's just a long history of kind of like mental health 20, 30 years ago. It wasn't seen as core primary care. That transition has happened over 2-3 decades. Oral health is kind of that same starting point where it just wasn't considered, like kind of above the neck, right? Eyes, ears, mental health tended to be not really and historically included as part of core healthcare. So that's changing now. And whether you're in Switzerland or in other places, you typically do find that dentistry is either financed separately, largely out of pocket, and delivered separately. So a really interesting statistic we found, for example, in the OECD, on average, the developed country, 26% on average of healthcare spending is financed privately, and the rest is through public insurance programs. For oral healthcare services, 70% on average is financed privately. So what you just said, right, is a very different decision, right? We're kind of like, okay, this is largely going to be out-of-pocket payments or private dental insurance plans. It's not going to be part of core. For example, in the UK, it is. It's one of those rare cases. But typically, it's not included in large national health insurance programs, etc., with some exceptions. One of the things we really wanted to drive home was, like, the last decade has seen a lot of compelling evidence showing oral health is linked to broader healthcare costs. So we know that when oral health improves, for example, among diabetes, pregnant people, people with cardiovascular disease, people with dementia, their healthcare costs go down. So if we invest in oral health, we see healthcare cost savings in other parts of the healthcare system. We didn't have that kind of compelling evidence 10, 20 years ago. We have that now. So we're hoping that even for the finance people, the numbers people, the economists, there's also a pretty compelling case to say, I should invest more in oral health because it saves me costs downstream. The question you're raising is, all right, now how do we organize the healthcare system such that it does that? How do we get more people access to oral healthcare? How do we leverage some of these ROIs, let's say? Not to mention the job market, right? So I live in the United States. 29% of low-income Americans say that their job prospects are limited due to the condition of their mouth and teeth. So that is a significant personal household cost we're paying. We know in low-income countries, a very large study we cited based on World Health Survey data, households that have high out-of-pocket costs due to oral health issues are more likely to be impoverished. So there's all sorts of these compelling arguments, and we're hoping now we can say, okay, let's act. What do we do about this? Right? What are some policy reforms we should consider?
So you mentioned there that there are links between the health of the mouth, the teeth, the gums, and these other things. I mean, to cite the report, better oral health has been associated with improved outcomes for people suffering from heart disease, respiratory disease, diabetes, dementia, arthritis, and for pregnant women. Now, I know you're not a doctor, you're a health economist, but can you give us some idea of why are these things linked to oral health?
With the caveat that I'm not a clinician, not a scientist, but more a numbers guy. It's multi-directional, right? So a lot of these studies essentially float around inflammation. So when you have inflammation in your mouth and your gums, that shows up as inflammatory symptoms in other parts of the body. Not going too deep into the science, which I am not an expert on at all. That's one of the core ones. Obviously, bacteria in the mouth are linked with other parts of the body too. The mouth biologically is the gateway to the rest of the body, so to speak. So there's a whole kind of microbiology link there as well. But a lot of this results just around inflammation. Oral cancer is different. That's, as I mentioned, one of the fastest rising types of cancers worldwide. It might be better measurement, tracking it better, diagnosing it better.
This is a global kind of survey. There must be massive regional differences. You've already mentioned it. Although poorer countries will have different healthcare systems, even more underfunded, presumably, than the wealthier countries, you're still seeing this similar thing. A lot of people suffer with oral health problems, and that inhibits their ability to work, to earn. There's kind of similarities all over the world for this.
You got it, but with the caveat, and this is important for the health equity agenda, the largest increases in the burden of disease are actually happening in low-income countries. Regionally, there's differences as well. I do want to highlight that there is an important health equity angle here, right? It's the low-income populations that are suffering most from this unmet needs and the burden of oral health diseases. And again, that's true when I look geographically across the globe as well as within a country, right? So if you take Switzerland or the UK or Canada, when you look within countries, the disparities with oral health outcomes are typically much larger than for other types of healthcare services as well.
It's bound to be that way, isn't it? If oral health treatment is an expensive kind of add-on to existing health services, there'll be poorer people in any society are going to be more reluctant to seek it out.
Correct. So it stems from the fact that, in most settings, we have not put oral health care services into that core basket of essential care that tends to be covered and mandated in either large NHS type systems or even, in the US, like an Affordable Care Act. Even though there's private insurance, we have regulations on what it needs to cover. And oral health for adults is, for example, here in the US, not been part of that core basket. And it's exactly because of those choices, right? So I wouldn't say expensive necessarily. If we had to pay 50% of our heart valve procedure cost, we would probably say, hey, that's super expensive, right? To me, it's more about the choice that, hey, we're saying, finance this privately, out of pocket, it's not core. The rest of this primary care, you'll be covered. That's what's driving this affordability challenge. As just as you said it, that's obviously going to bite much harder for low-income, financially constrained households, and that's exactly what we're seeing in the data.
So what needs to change? You mentioned you were attending the World Health Organization meeting. You're talking to policymakers. What are you hoping will happen? What will be the knock-on effect of this paper that you've published?
We highlighted 4 areas of action among policymakers. One is to adopt health financing policies that address the financial barriers to care. And that's very broad. So if you're in a largely publicly financed system, you're going to work through your NHS type of insurance model. If you're in a Bismarckian or a hybrid scheme where there's privately provided health insurance, you can regulate that to say, hey, include these core healthcare services. Area 2 is on the delivery side, integrate oral health into primary care touch points, right? So not have this separate delivery system. And there's lots of great examples around the world where that's happening. Third is we're going to have to look at different types of workforce models. Kind of the OECD Western country workforce model will not be appropriate in low-income settings. So we need to do some meaningful reforms there. The fourth one we haven't talked about much is really focus on upstream prevention and promoting healthy behaviors. There's sugar consumption, and whether you drink fluoridated water or use fluoride toothpaste, these are at-home behaviors that are really important. But there's ways policymakers can incentivize those. For example, taxing sugar-sweetened beverages. There's some experiments there. So number 1, address the financing gap. Number 2, integrate oral health care services into primary care. Number 3, explore innovative workforce models. And number 4, adopt policies that promote healthy habits upstream.
If we were to take those recommendations, would there still be barriers to that? Is it just that countries or organizations, hospitals or doctors groups or whatever need to change a bit their outlook? It's often hard to affect change in healthcare or other parts of the economy. Or what do you see as the big barriers preventing this?
I could see a few, right? You mentioned a big one, right? There's always let's say on the practitioner community, and this is not unique to oral health, right? There's long histories of, for example, workforce reform tends to be controversial to those in the status quo. So there's definitely potentially resistance among some pockets of the provider community. Potentially, you're competing for healthcare dollars for other things that also have a return on investment, right? Like oral health is not the only thing that drives better job prospects or better school outcomes. We have compelling evidence that it does, certainly. But, so does mental health, and so do other types of investments. And that's not a bad thing, right? Policymakers should look at all this. But thankfully, we also in the report highlight cases where we've broken through those barriers. Countries have addressed some of those resistances. We highlight the case, Japan, Germany, 2 countries, big public investments in oral health, very low barriers to oral health care services, lots of access, good stories. Thailand, Brazil, another set of countries that have had a long history of actually including oral health care as part of their universal coverage. That's another thing, right? We have examples where countries have sort of bucked the global trend and said, no, healthcare for your mouth is essential.
And in those examples, in those countries, are you seeing improvements to the kind of metrics that you're measuring here in this paper?
Where we have data and where we're able to make those assessments, yes. That's why they were included. But there's a whole other wonky discussion we could have on research. Like we struggled and we went really hard to put in kind of the scientific literature. There's so much that we can do better in terms of tracking, evaluating policy reform. That's for another discussion. That's for the researchers and the scientists. But yes, in the paper, you can see some very nice case studies where you see, in Japan, tooth retention has skyrocketed. The burden has been managed much better, et cetera. Thailand, many more people going to the dentist. So yes, we do.
So where do things go from here? You've published this report. You've mentioned this grouping called the Oral Health Affinity Group, which is made up of, I'm reading here, more than 50 companies committed to advancing health equity to create stronger, more productive societies. So the work of that group continue now?
We feel this is just the start. So the point of this first piece was to say, let's get something out that makes the economic case. That is just a starting point. And we feel our next steps, number one, are obviously getting the word out, but we really want to leverage the forum's ability to kind of convene and to host some listening sessions, let's say. We think this is really important. We think this is impactful. We think this will push people to act. But let's actually sit with the people, the leaders in civil society, the private sector, and governments. And let's ask them, hey, what would make you go all in on this? Is it more evidence? Is it a political economy issue? Is it, I don't know what to do, in which case, what are the right policies, right? What works in my setting? We're not a group that thinks we have the answers at all. We're exploring that. I don't have solid answers yet, but we're just at the starting point. We are at a great moment where we're going to see a lot of action on oral health in the coming years. This is exciting. And we all know mouth is connected to body, and we need to stop paying that economic penalty for neglecting oral diseases.
Marko Vujicic, Chief Economist and Vice President, Health Policy Institute at the American Dental Association. The report he was talking about was published by the World Economic Forum in collaboration with the American Dental Association, Colgate-Palmolive Company, and Henry Schein Inc. You can read it on our website. Links in the show notes. The World Economic Forum's Centre for Health and Healthcare is committed to pioneering strategies that enhance global healthcare, ensuring the well-being of people across societies and nations. For more initiatives on healthcare, visit the Centre's website, links in the show notes. Please subscribe to Radio Davos wherever you get your podcasts, and please leave us a rating or a review, and join the conversation on the World Economic Forum Podcast Club on Facebook. This episode of Radio Davos was written and presented by me, Robin Pomeroy. Editing was by Jerry Johansson. Studio production by Taz Kelleher. We'll be back next week. But for now, thanks to you for listening, and goodbye.